Hey guys, welcome to your lesson on the treatment and evaluation of psychological disorders. We're going to start off by talking about what the difference is between psychotherapy and biomedical therapy. Psychotherapy is treatment involving psychological techniques, consists of interactions between a trained therapist and someone seeking to overcome psychological difficulties or achieve personal growth. So there doesn't have to be anything wrong per se for someone to attend psychotherapy. They can just want to be growing and become a better person. Biomedical therapy is prescribed medications or procedures that act directly on the person's physiology. How might an illness be treated in each of these therapies? So with psychotherapy, the therapist may explore a client's early relationships, encourage the client to adopt new ways of thinking, or coach the client in replacing old behaviors with new ones. With biomedical therapy, the psychiatrist or doctor may prescribe antidepressants for a person with severe depression or may suggest electroconvulsive shock therapy, ECT, or deep brain stimulation. AP exam tips. So most of the treatments discussed in this unit come from the perspectives that we've already learned about in Unit 1, which was psychology's history and approaches. While reading each major section on therapy, try to anticipate how a psychologist from that perspective would approach therapy. This should help organize the information and aid in remembering for the AP exam. What's the eclectic approach to psychotherapy? This is an approach to psychotherapy that uses techniques from various forms of therapy. Some therapists combine techniques. Indeed, many psychotherapists describe their approach as eclectic, using a blend of different therapies. For instance, a therapist may use dream interpretation or free association during sessions, which is psychoanalytic, but also help you to change your flawed or faulty thinking patterns, which is cognitive. What is psychoanalysis? Back to Freud we go. Freud believed the patient's free associations, resistances, dreams, and transferences, and the therapist's interpretations of them, release previously repressed feelings, allowing the patient to gain self-insight. He called this technique psychoanalysis. What are the underlying beliefs of psychoanalysis? Freud believed that in therapy, people could achieve healthier, less anxious living by releasing the energy they had previously devoted to id, ego, superego conflicts, discussed earlier this unit. Freud assumed that we do not fully know ourselves. He believed that there are threatening things we repress, things we do not want to know, so we disavow or deny them. How does free association work? Imagine yourself as a patient using free association. You begin by relaxing, perhaps by laying on a couch. The psychoanalyst, who sits out of your line of vision, asks you to say aloud whatever comes to mind. At one moment, you're relating a childhood memory. At another, you're describing a dream or recent experience. Soon you notice how often you edit your thoughts as you speak. You pause for a second before uttering an embarrassing thought. You omit what seems trivial, irrelevant, or shameful. Sometimes your mind goes blank or you clutch up, unable to remember important details. You may joke or change the subject to something less threatening. What is resistance? In psychoanalysis, the blocking from conscious of anxiety-laden material. To the analyst, the mental blocks and editing that occur during free association indicate resistance. They hint that anxiety lurks and you are defending against sensitive material. The analyst will note your resistance and then provide insight into its meaning. What is interpretation? In psychoanalysis, the analyst noting supposed dream meanings, resistances, and other significant behaviors and events in order to promote insight. If offered at the right moment, the therapist's interpretation of, say, you're not wanting to talk about your mother, or call, text, or message her, may illuminate the underlying wishes, feelings, and conflicts you are avoiding. What is transference? In psychoanalysis, the patient's transferred to the analyst of emotions linked with other relationships, such as love or hatred for a parent. Over many sessions, your relationship patterns surface in your interaction with your therapist. You may find yourself experiencing strong positive or negative feelings for your analyst. The analyst may suggest you are transferring feelings, such as dependency or mingled love and anger, that you experienced in early relationships with family members or other important people. What are some drawbacks to traditional psychoanalysis? Relatively few North American therapists now offer traditional psychoanalysis. Much of its underlying theory is not supported by scientific research. Analysts' interpretations cannot be proven or disproven, and it takes considerable time and money, often years of several sessions per week. Some of these problems have been addressed in the modern psychodynamic perspective that has evolved from psychoanalysis. What is psychodynamic therapy? Therapy deriving from the psychoanalytic tradition views individuals as responding to unconscious forces and childhood experiences and seeks to enhance self-insight. Although influenced by Freud's ideas, psychodynamic therapists don't talk much about id-ego, superego conflicts. Instead, they try to help people understand their current symptoms by focusing on important relationships, including childhood experiences and the therapist-client relationship. What are some differences in psychodynamic theory? Client therapist meetings take place once or twice a week rather than several times weekly, and often for only a few weeks or months. Rather than lying on a couch out of the therapist's line of view, clients meet with their therapist face to face and gain perspective by exploring defended against thoughts and feelings. What are the insight therapies? These are therapies that aim to improve psychological functioning by increasing a person's awareness of underlying motives and defenses. Because they share the goal of helping patients gain insight into their problems, the psychodynamic and humanistic therapies are often referred to as insight therapies. But humanistic therapies differ from psychodynamic therapies in many ways. Humanistic therapists aim to boost people's self-fulfillment by helping them grow in self-awareness and self-acceptance. The path to growth is taking immediate responsibility for one's feelings and actions rather than uncovering hidden determinants. Promoting growth, not curing illness, is the therapy focus. Individuals in therapy are often referred to as clients rather than patients. Conscious thoughts are more important than the unconscious. The present and future are more important than the past. Therapy focuses on exploring feelings as they occur, rather than on achieving insights into the childhood origins of those feelings. What is client-centered therapy? This is a humanistic therapy developed by Carl Rogers in which the therapist uses techniques such as active listening within an accepting, genuine, empathetic environment to facilitate clients' growth, also called person-centered therapy. In this non-directive therapy, the client leads the discussion. The therapist listens without judging or interpreting and refrains from directing the client towards certain insights. What were Carl Rogers' beliefs about growth and how to help clients achieve it? Believing that most people possess the resources for growth, Carl Rogers encouraged therapists to foster that growth by exhibiting acceptance, genuineness, and empathy. When therapists enable their clients to feel unconditionally accepted, drop their facades, and genuinely express their true feelings, and empathetically sense and reflect their clients' feelings, the clients may deepen their self-understanding and self-acceptance. What is active listening? This is empathetic listening in which the listener echoes, restates, and clarifies. To Rogers, hearing was active listening. The client-centered therapist echoes, restates, and seeks clarification of what the person expresses, verbally or non-verbally, and acknowledges those expressed feelings. Active listening is now an accepted part of counseling practices in many schools, colleges, and clinics. An example of active listening in dialogue. Feel free to please pause this and read through it. What is unconditional positive regard? This is a caring, accepting, non-judgmental attitude, which Carl Rogers believed would help clients develop self-awareness and self-acceptance. Given a non-judgmental, grace-filled environment that provides unconditional positive regard, people may accept even their worst traits and feel valued and whole. How can we listen more actively? Paraphrase. Check your understanding by summarizing the person's words out loud in your own words. Invite clarification. What might be an example of that? That may encourage the person to say more. Reflect feelings. It sounds frustrating. That might mirror what you're sensing from the person's body language and intensity. How does behavior therapy differ from psychodynamic and humanistic therapy? The psychodynamic and humanistic therapies, the insight therapies, expect people's problems to diminish as they gain insight into their unresolved and unconscious tensions, and as people get in touch with their feelings. Rather than delving deeply below the surface looking for inner causes, behavior therapists assume that problem behaviors are the problems. If maladaptive symptoms are learned behaviors, why not apply learning principles to replace them with new constructive behaviors? How can maladaptive behaviors be learned? As Pavlov and others showed, we learn various behaviors and emotions through classical conditioning. If we're attacked by a dog, we may thereafter have a conditioned involuntary fear response when other dogs approach. Our fear generalizes and all dogs become conditioned stimuli. So, if phobias, anxiety, and perhaps depression can be learned, can they be unlearned? What is counter conditioning? This is behavior therapy procedures that use classical conditioning to evoke new responses to stimuli that are triggering unwanted behaviors. Include exposure therapies and aversive conditioning. Pairing the fear-provoking stimulus with new positive responses can change the behavior. What are exposure therapies? Behavioral techniques such as systematic desensitization and virtual reality exposure therapy that treat anxieties by exposing people in imaginary or actual situations to the things they fear and avoid. These therapies, in a variety of ways, try to change people's reactions by repeatedly exposing them to stimuli that trigger unwanted reactions. With repeated exposure to what they normally avoid or escape, people adapt. What is systematic desensitization? This is a type of exposure therapy that associates a pleasant, relaxed state with gradually increasing anxiety triggering stimuli. Behavior therapists utilizing the tool of systematic desensitization might have an anxious patient develop an anxiety hierarchy of stimuli that are causing fear and help the patient to work through each step on the hierarchy, getting closer and closer to the fear-producing stimulus. At each level of the hierarchy, relaxation methods are practiced until the client is calm at that level of exposure. How does systematic desensitization work? For instance, a person with a phobia of flying may first learn to relax when looking at airline sale ads in the paper, then learn to relax when driving by an airport. The therapist may then have the patient visit a museum of aircraft and work on relaxation techniques. At each new level or step of fear is mastered with relaxation, the patient soon attempts to sit on a plane or fly on a plane. What is virtual reality exposure therapy? This is a counter conditioning technique that treats anxiety through creative electronic simulations in which people can safely face their greatest fears, such as airplane flying, spiders, or public speaking. This works by sitting safely in a room with the therapist. The patient wears virtual reality goggles. People see vivid simulations of feared stimuli, such as walking across a rickety bridge high off the ground. What is aversive conditioning? This type of counter conditioning that associates an unpleasant state, such as nausea, with an unwanted behavior, such as drinking alcohol. Aversive conditioning procedure is simple. It associates that unwanted behavior with unpleasant feelings. For example, to treat nail biting, the therapist may suggest painting the fingernails with a nasty tasting nail polish. How does aversion therapy work? So, after repeatedly drinking alcohol mixed with a drug that produces severe nausea, some people with a history of alcohol use disorder develop at least a temporary conditioned aversion to alcohol. So if you look at the diagram, we have unconditioned stimulus produces unconditioned response, drug, nausea. We have and moving down, we've got alcohol plus drug equals nausea. And then moving down one more, we now have the conditioned stimulus, alcohol, producing the conditioned response nausea that we wanted so that that person no longer drinks because they associate alcohol with being nauseous. What is behavior modification? So, reinforcing behavior is considered desirable, and failing to reinforce or sometimes punishing behavior is considered undesirable. Therapists practicing behavior modification use operant conditioning principles, such as giving positive reinforcement to shape wanted behavior and using punishment to decrease unwanted behavior. In a step by step manner, they rewarded closer and closer approximations of the desired behavior. What research has been conducted on behavior modification? So one study worked with 19 withdrawn uncommunicative 3-year-olds with autism spectrum disorder, ASD. For 2 years, 40 hours each week, the children's parents attempted to shape their behavior. They positively reinforced desired behaviors and ignored or punished aggressive and self-abusive behaviors. The combination worked wonders for some children. By first grade, 9 of the 19 were functioning successfully in school and exhibiting normal intelligence. In a group of 40 comparable children not undergoing this effortful treatment, only 1 showed similar improvement. What is a token economy? This is an operant conditioning procedure in which people earn a token, a chip, stamp, or other non-monetary item, for exhibiting a desired behavior and can later exchange tokens for privileges or treats. For instance, when people display a desired behavior, such as getting out of bed, washing, dressing, eating, talking coherently, cleaning up their room, playing cooperatively, they receive a token or plastic coin. Later, they can exchange a number of these tokens for rewards, such as candy, TV time, day trips, or better living quarters. What are 2 criticisms of behavior modification? Well, how durable are these behaviors? Will people become so dependent on extrinsic rewards that the desired behaviors will stop when the reinforcers stop? Is it right for one human to control another's behavior? Those who set up token economies deprive people of something they desire and decide which behaviors to reinforce. To critics, this whole process feels too authoritarian. What's cognitive therapy? This is therapy that teaches people new, more adaptive ways of thinking based on the assumption that thoughts intervene between events and our emotional reactions. The cognitive therapies assume that our thinking colors our feelings. Between an event and a response lies the mind. Self-blaming and overgeneralized explanations of bad events feed depression. Anxiety arises from an attention bias to threat. What is the cognitive perspective on psychological disorders? The person's emotional reactions are produced not directly by the event, but by the person's thoughts in response to the event. So we have 2 situations where a person's lost a job. In the first one, the internal beliefs are I'm worthless, it's hopeless, and lead to depression. And the second one, the person's thinking response was, it wasn't a good fit, I deserve something better, which leads to no depression. What is rational emotive behavior therapy, REBT? This is a confrontational cognitive therapy developed by Albert Ellis that vigorously challenges people's illogical, self-defeating attitudes and assumptions. According to Albert Ellis, the creator of rational emotive behavioral therapy, many problems arise from irrational thinking. How has Aaron Beck contributed to the field? In the late 60s, a woman left a party early. Things had not gone well. She felt disconnected from the other partygoers and assumed no one cared for her. A few days later, she visited cognitive therapist Aaron Beck, who challenged her thinking. After she then listed a dozen people who did care for her, Beck realized that challenging people's automatic negative thoughts could be therapeutic. Beck's cognitive therapy assumes that changing people's thinking can change their functioning. What is catastrophizing? Perhaps you can identify with the anxious students who, before a test, make matters worse with self-defeating thoughts, such as, this test's probably going to be impossible. Everyone seems so relaxed and confident. I wish I were better prepared. I'm so nervous I'll forget everything. Psychologists call this sort of relentless, overgeneralized, self-blaming behavior catastrophizing. What are some cognitive therapy techniques? And this is, I copied this table for you in your lesson so that you can reference it. We've got the aim of the technique, to reveal beliefs, test beliefs, or change beliefs. And then we have the technique itself, and then the therapist directives. What is CBT, cognitive behavioral therapy? This is a popular integrative therapy that combines cognitive therapy, changing self-defeating thinking, with behavior therapy, changing behavior. It takes a combined approach to depression and other disorders. This widely practiced integrative therapy aims to alter not only the way people think, but also the way they act. How do cognitive therapists help people with eating disorders? Cognitive therapists guide people toward new ways of explaining their good and bad experiences. By recording positive events and how she has enabled them, this woman may become more mindful of her self control and more optimistic. What's group therapy? This is therapy conducted with groups rather than individuals, providing benefits from group interaction that you wouldn't get if you were in individual therapy. Family therapy is therapy that treats people in the context of their family system and views an individual's unwanted behaviors as influenced by or directed at other family members. What are the benefits of group and family therapy? Well, group therapy helps more people and costs less per person than individual. Learning that others have similar problems is a benefit, and you get feedback on new ways of behaving. Family therapy helps family members identify their roles within the family social system, improves communication, and discover new ways of preventing or resolving conflicts. Self-help groups. More than 100 million Americans have belonged to small religious interest or support groups that meet regularly, with 9 in 10 reporting that group members support each other emotionally. In an individualist age, with more and more people living alone or feeling isolated, the popularity of support groups for the addicted, the bereaved, the divorced, simply those seeking fellowship and growth, may reflect a longing for community and connectedness. This last slide is also a table in your notes. This is comparing modern psychotherapies. So this is the evaluating section. Psychodynamic, client-centered, behavior, cognitive behavioral, and group and family are the main types of therapies that we went over in this lesson. We have the presumed problem for each type of therapy, the aim of the therapy, and then the technique for that therapy. You'll be using this when you complete your case studies, so make sure that you study this table and reference it when you're completing all your work so that these become kind of second nature to you. Have a great rest of your day.